A little bit about me before I get started. My name is Nicole Thibodeau. I'm a registered nurse. I have been for 11 years. I know I look like I'm, late teens, early 20s. Thank you. I'm a mom of 3. I homeschool my kids. I moved here from Boston. I was born and raised and educated there, most of my work experience there. I work in home health. I moved here and I started my own business. I provide private in-home nursing services. So I mostly work with the aging population because they tend to need help in the home, or they don't have family locally to help. So I do private care for medication management, for ostomy care, a lot of things that insurance won't cover. But then I can also step in and manage things like complex wounds and that. So I think you guys know more about Parkinson's than I do, so I'm going to touch on that and how it relates to these conditions, but I'm going to give some more information about conditions that are prevalent in the aging population and often are hand in hand with Parkinson's disease. So thank you, Parkinson Place Center, for having me. I do have a disclaimer here. I'm spreading awareness. I am not your doctor. You don't need to listen to anything that I say. I'm not here to give you any kind of medical advice. This is research that I have done. I tend to take a more holistic approach, and I look at root causes of disease versus here's a pill, let's try to fix like the symptoms, right? It's what's causing this is what we really need to start asking. So I'm raising awareness. So does anybody shout it out if you want to guess any, the 10 common chronic conditions for adults over the age of 65 in America? Go ahead, just shout it out. What is that? Bad knees. Arthritis. I'll take it. Diabetes. Yeah. Heart disease. Yes. High blood pressure. Here we go. So high blood pressure, number 1, 60%. High cholesterol, obesity, arthritis, heart disease. You guys were pretty good. Diabetes, chronic kidney disease, heart failure, depression, and Alzheimer's and dementia diseases. So we're going to talk about a few of these today. So here's just a kind of shocking snippet of the total cost that are spent on these most commonly prescribed medications. I'll leave this up there for a minute, but I'll make some highlights here. These drugs treat high blood pressure, high cholesterol, hypothyroidism, diabetes, chronic nerve pain, COPD and asthma, and the omeprazole is for, indigestion and GERD, gastric reflux. So those are some pretty hefty prices we spend on these medications. And this, I feel, is just a little humorous because it summarizes my take, my approach to patients. When I care for a patient, I'm not going to take this approach. Your disease is caused by your lifestyle. Oh, so I should change my lifestyle? No. Here's a pill. Here's another pill, and here's a pill for that pill. Okay? So this is kind of just, it's humorous, but it's also true in that we need to do more than just pop a pill and hope that it's going to fix the problem. So again, this is all just kind of raising awareness, some information. So here is medications in the common examples category and the things that they're treating, the blood pressure, high cholesterol, diabetes, these things. And you'll see here in this column, by taking these medications, these are common vitamins that are depleted. These are common minerals that may be depleted by the medication. And these are antioxidants, hormones, and nutrients that may be depleted from taking these medications. So one thing I noticed by looking at this chart is that all of these medications deplete you in some way of B vitamins, okay? Folic acid, that's a B vitamin, B12, B6, B2, B1. So one thing you might want to consider is if you're taking any of the medication categories listed here to treat one of these things here that you have, it's important for you to know what supplements you might need to take to offset what your medication might have an adverse effect of doing there. So, causes of Parkinson's disease. So some of these slides look very heavy. I'm not going to read them word for word to you because you'll be very bored. They're long. So genetic factors, that's one, very common, right? That's what we like to think, but 10 to 15% of cases, that's not a lot. That means there's a lot of other causes that maybe we can address, right? There's only so much we can do for genetics, but genetics doesn't mean, it doesn't equal the disease, right? It puts you at higher risk. It puts you at a predisposed risk. So that's one thing to consider. Those usually appear earlier in life. So getting Parkinson's young, you may have genetic risk factors there. Environmental exposure, this is huge, okay? Glyphosate is in like almost everything. Everything comes from corn in America, genetically modified corn, and it's sprayed with glyphosate. That's Roundup, right? So we have that in our breads. We have that in almost everything in American processed food. So these are just things. Paraquat is a common pesticide. Heavy metals, you're going to see that very common throughout all of these disease causes I'm going to mention. That is going to be one of the trends. Then there's mitochondrial dysfunction and oxidative stress. That's another factor. It's a buildup of free radicals, inflammation, and those things eventually cause death of your neurons. Another huge theme we're going to see is gut-brain disbalance or imbalance, the microbiome imbalance, where, have you ever heard you are what you eat and you are what you eat eats? And your immune system is so heavily linked to your gut. So if in America we're eating a lot of processed foods, a lot of genetically modified foods, a lot of things that are refined and pasteurized, right? We're also eating a lot of things that are, they're not as nutritional. Have you guys heard that an orange today is 20% of the nutrition value that an orange 50 years ago was? That the fruit has changed the products, right? Because if there's not the nutrients in the soil, it's not going to be in the fruit either. So part of it is that we're using a lot of pesticides and herbicides, and we're not flipping the fields, right? Back in farming, they would do, corn, and then the next year soybeans. So there needs to be where you're not depleting the soil of the nutrients. But that's a whole nother lecture. So I'll move on. So chronic inflammation, I did kind of already mention that, and it's linked to immunity. Inflammation is found in Parkinson's disease patients. Immune dysregulation can cause further stress. This one was surprising to me, head trauma. I don't know if that shocks anybody else, but contact sports or military service, because of its likelihood to cause microbleeds or trigger abnormal protein accumulation called Lewy bodies. Maybe you've heard of Lewy body dementia, but that's also common in Parkinson's disease, the buildup of Lewy bodies. Lifestyle and metabolic contributors. So these are some other factors that will be touched on with a lot of these diseases we're going to talk about, but sedentary lifestyle, poor diet, chronic stress, having a toxic burden, mold, microplastics. That's one of those newer words we're starting to hear more and more, right? Oh, BPH is terrible. We eradicate it, but what they replaced it with is actually just as bad, maybe worse. So there's a lot of things in our environment that are not working with us in being healthy. Insulin resistance and metabolic syndrome. And then protective factors. So these are some things that are worth looking into doing if it's not something you're already aware of. But exercise, of course, it looks like you guys have quite the setup here to be doing that. So awesome. Caffeine, interesting take, right? Plant-rich diets, anti-inflammatory and Mediterranean diets, those are high in healthy fats. Vitamin D, omega-3s, antioxidants like glutathione and CoQ10, which are both very helpful for the liver. So the first of the 4 diseases that I'm going to talk about today is hypertension or high blood pressure. So we all know, oh, high blood pressure, everybody has it, we throw it around, but what does that mean when your blood pressure is high? What's really going on here? So this chart shows us what a normal reading for the systolic, which is the top number, and a diastolic, what's the bottom number. We're usually not treating hypertension until what, stage 2? When your blood pressure is 140 or higher consistently, then your doctor says, here's a pill, okay? And they may have told you, right, there's some lifestyle changes that need to be made, and you need to lose some weight, and you need to exercise more, and, and you do those things, but your blood pressure may not dramatically because there's so many other factors to consider. And it's important. We don't want the blood pressure to stay that high. So I'm not saying by any means not to take those kinds of things, those medications, but I want to raise awareness in all of the other things that we can be doing to treat these diseases. So we wait till it's maybe 140 or higher to start treating. But let's look at this. Systolic blood pressure. So that top number, 120, right? We want it less than 120 or less than 80 on the bottom number. What that means is when the heart contracts, what the blood pressure raises to. And then the heart relaxes for a split second before it beats again. It's the pressure when the heart contracts and the pressure when the heart relaxes, the pressure within the arteries when that's happening. So your blood pressure is doing this. This is top number, bottom number, top number, bottom number. So when the top number is high, it tells us that the heart is working too hard because the pressure is staying high. And when the bottom number is high, it tells us that the heart isn't getting rest. When it relaxes for that split second before the next beat, it's not getting the rest that it needs. Here's some common symptoms of hypertension. Most people, I would say, don't experience any symptoms of high blood pressure until it's very high, but some of these might be surprising. Some of them make perfect sense. And then on that side there, you can see at the top with hypertension how the vessels are narrowed. See, these walls are kind of closing in there. You're seeing vasoconstriction, where on the bottom in a normal vessel, it's wide open and everything can flow pretty freely. Hypertension affects your whole body. Heart disease, depression, issues with sexual dysfunction, kidneys, vision, bone loss. Complications of hypertension. So this is called the 5 C's. So we've got coronary artery disease, which is disease of the vessels, the coronary arteries around the heart, on the heart. Chronic renal failure, that's kidney damage. Congestive heart failure, so that's damage to the heart where it's just not pumping as effectively. It's not clearing as much fluid and blood as it needs to push that to where it needs to go. Cardiac arrest, we know, is a heart attack. And cerebrovascular accident, that is stroke. I'm not going to spend too much time on the medications because I think this presentation is really long, so I won't keep you guys longer than my allotted time. But those are some common medications for different heart medications, what they treat specifically, and some contraindications for those classes of medications. So here's some of those common ones I circled in red already. Lisinopril, losartan, doxazosin, metoprolol, amlodipine, furosemide. While conventional medicine often focuses on treating the symptoms of hypertension with medications, functional medicine aims to identify and address the underlying cause. So allopathic disease is symptom management. That's what most universities train their doctors to do is, okay, you have high blood pressure, let's get the blood pressure low. You have high cholesterol, let's lower the cholesterol. Where we're looking at numbers and then we want to see better numbers, right? We want to see that there's a measurable difference there. So these medications do that. They help the numbers look better, but they're not necessarily fixing the reason why the blood pressure is high, why the cholesterol is high. So disease-specific nutrition approach. So these are some supplements that can be beneficial in high blood pressure. Not necessarily curative. We're talking a few points at best, these kinds of supplements. And again, I'm not telling you to take these. I am not your doctor. Causes of high blood pressure. So insulin resistance and prediabetes. Here it is again, the heavy metal toxicity, lead, mercury, cadmium, are the most common. Aluminum is also another big one. Sleep apnea, because you're not getting enough oxygen, right? So then it may cause the pressure to be higher. Deficiencies of different nutrients and vitamins and minerals. Bacterial infections, this would be chronic. It doesn't mean like, oh, you get strep throat and then now you have high blood pressure for the rest of your life. This is like a chronic untreated bacterial, a long-term. H. pylori, that's a stomach infection that causes ulcers in your stomach, but it's sometimes hard to identify. Viral infections, cytomegalovirus, Coxsackie disease. Chronic stress can cause hypertension. I'm sure that's a pretty common one, more so among men even. Lack of physical activity, environmental toxins, and impaired detoxability. And that impaired detoxability, addressing your liver and your kidneys' ability to clear your body of toxins, is going to help eradicate half of the things on this list. The deficiencies, you could take all the healthy vitamins and supplements, but if your body can't process and clear, if you're kind of clogged up, your liver and your kidneys aren't able to cleanse and detox you, then your body cannot actually use and access the healthy supplements that you're taking. So being able to have a cleared lymphatic system, liver and kidneys, is the first step in trying to address these other things. So then here's another thing, is medicines can cause high blood pressure. So maybe you're taking an antidepressant medication and that in turn has unfortunately resulted in your blood pressure being sustained, elevated. So these, I won't read all of them, but antacids that contain sodium, those are pretty common, to be taking Tums and things like that. So take a look at, what other factors might be with medications. Systemic corticosteroids like prednisone, nicotine, even herbal supplements. I actually, no joke, I have a patient right now that I am caring for, and he loves Twizzlers. This man, he eats Twizzlers like by the bag, okay? So not only is this causing some GI upset, but his blood pressure has been high. And I'm like, what is going on here? Because we track his blood pressure. He keeps a log on his calendar. And I'm like, oh my goodness, he stopped eating licorice, blood pressure problem resolved. So if you eat massive amounts of licorice, you could have some problems. Right, so Parkinson's disease and hypertension. So there is a relationship here, and I'm gonna touch on that more on the next screen. So early and late. So early on in Parkinson's, you may be more likely to have high blood pressure, especially if you already had high blood pressure before your Parkinson's diagnosis. But later on, as Parkinson's progresses, you may end up having orthostatic hypotension, which is a drop in your blood pressure with changes in position. So when you go from lying to sitting to standing, your blood pressure isn't compensating, right? Because your blood pressure is going to be lower when you're lying down. Everything is relaxed and calm. And when you stand up, your body should compensate and raise the blood pressure to accommodate for your change in position. And what happens is sometimes it does not compensate, the blood pressure stays low and you feel dizzy and could faint. And that is related to the autonomic dysfunction, which is affected by Parkinson's disease. The autonomic nervous system is the things that you can't necessarily control. You can't exactly control your heart rate, your blood pressure, your digestion. So that can cause erratic blood pressure. Effects of medications, dopaminergic medications like levodopa can cause a drop in your blood pressure. And that can complicate treatments because if you have high blood pressure, but then you end up with orthostatic hypotension, now we need to play teeter-totter, trying to balance treating. We don't want your blood pressure this high, but if we get it down here and then you stand up, then it drops to here. So it can certainly be difficult to juggle finding the right balance of where we want your blood pressure. There are some other risk factors there, cardiovascular risks. Like I said, having the blood pressure too high can cause problems, but too low can cause problems. So common treatments, I don't think any of these are shocking. Losing weight, eating a heart-healthy diet, reducing dietary sodium. I will mention here, not all salt is created equal. Table salt is a highly refined salt, and it's sodium chloride, right? There are other salts. I personally like Celtic salt. I'm not paid. This is not an endorsement by any means. Redmond salt is a little more gritty, but I really like the Celtic salt. It also has magnesium and potassium and calcium in addition to sodium. So it's a little more got a little bit of everything. And that's not a bad thing. We drink a Gatorade, but Gatorade doesn't actually have all of those other things that natural salt might have. Potassium-rich foods, common intervention for treating high blood pressure. Exercise, moderating alcohol consumption. And then here are some uncommon treatments. An anti-inflammatory diet, so low in processed foods, fruits, veggies, whole grains, nuts, seeds, fatty fish. And now we have to be careful where our fish comes from, right? Because these farms, and then they put dyes and they inject water to make the fish look heavier and juicier. Anti-inflammatory nutrients, vitamins A, C, E, magnesium, polyphenols, found in berries, leafy greens, green tea. Taking magnesium daily can be beneficial for blood pressure. But again, you take magnesium, we're seeing maybe a 5-point difference. So if your blood pressure is 150, it may get you to 145. We're not expecting that magnesium is the cure-all, right? It's just a benefit. It's going to be helpful. 7 to 9 hours of quality sleep. That's hard to get depending on your stage of life and whether your sleep is, interrupted. Mind-body practices to reduce stress, addressing gut health, prebiotics, probiotics, fiber, gut healing nutrients like L-glutamine, and some herbs, ginger, boswellia, turmeric, can reduce inflammation. And CoQ10, you'll see that one a lot coming out through here, L-arginine, citrulline, and nitrates. So moving on to dementia. So dementia is not a part of normal aging. I think it's extremely common, but I will say things that are common are not normal. Just because it's common doesn't make it normal. So normal aging, I think I already have some of these signs, so I'm in for it. Occasionally misplacing your car keys, struggling to find a word, but remembering it later, and, just forgetfulness. Of those 65 and older, there's an estimated 5 million adults with dementia as of 11 years ago, and there's projected to be almost triple that by 2060. But again, are we addressing the cause? I don't think so. I mean, in biblical days, they were living like hundreds of years. I don't know. We don't have records of that, but what's that? So dementia, I don't think any of this is new information, affects memory, attention, communication, judgment, reasoning, problem solving, visual perception, signs that could point to dementia, getting lost in familiar places, using unusual words to refer to a familiar object, forgetting names, old memories, not being able to complete tasks independently. There are many types of dementia. We've all heard of Alzheimer's dementia. That is the most common cause. About 70% of people with dementia have Alzheimer's disease. And that with that family history is the most important risk factor. Difficulty with walking or talking, personality changes come later on in the disease. Vascular dementia is when there's a lack of oxygen to the brain because of a lack of blood flow. So if things are real, clogged up, then you're going to be at risk for strokes or other issues. And with that, diabetes, high blood pressure, and high cholesterol are also risk factors. Lewy body dementia, we'll touch on that in just a few minutes. Though some of those symptoms are very similar to Parkinsonism symptoms. They have movement or balance problems, stiffness, trembling, daytime sleepiness, confusion, staring spells, hallucinations, and trouble sleeping. Frontotemporal dementia, that's when you see degeneration in the frontal cortex here in the frontal lobe, where your personality and your behavior, your impulse control are regulated there. So they may behave very inappropriately, just emotionally unregulated, problems with language skills, speaking and understanding. Mixed dementia is having more than one kind of dementia, and when you've got it compounded, it may progress more quickly. And reversible causes of dementia, that's interesting because you didn't know that there was dementia that could be reversed, right? That would be when it's a side effect of medication, which I have seen and experienced statins. There was a man whose body could not metabolize his cholesterol medication, and it built up at toxic levels in his body. They put him in a nursing home. He could no longer function independently. And when the right doctor came along and said, hey, let's stop this medication, let's do a blood test, they found out he had toxic levels that built up because his body couldn't metabolize the drug for whatever reason. And when they stopped that medication, he regained all independence. Wild. Vitamin deficiencies and thyroid and hormone imbalances can all be addressed as well. So according to the Alzheimer's Association, dementia is caused by a variety of diseases that cause damage to brain cells. Kind of vague. So I read this a few times and I didn't feel like I fully understood what it was explaining. But doing a little bit more research and looking at the risk factors and the causes, age is a factor. Of course, you're more likely to have dementia the older you get, but it's not normal. Lifestyle choices and genetic factors, again, always a cause there. Metabolic dysfunction, so having likelihood or existing hypertension, hyperlipidemia, which is similar to high cholesterol, hyperlipids, cardiovascular disease and obesity, also with glycotoxicity, that's going to be your diabetes, insulin resistance, lack of oxygen. Diseases that cause a lack of oxygen can predispose you to dementia. Toxicity, here we go, heavy metals, medications, again, if your body couldn't metabolize a medication, mycotoxins that can be found in different foods. It's a kind of a fungal component that is unhealthy in something like peanuts. Glyphosate, chemical additives in foods, pharmaceuticals can sometimes cause cognitive decline because sometimes they're lowering essential antioxidants and nutrients that are needed for cellular health. Hormones, having low levels of certain hormones, nutrient deficiencies, vitamin D, not getting enough vitamin D, chronic infections, untreated herpes, Lyme disease, or gingivitis even. It's shocking. And traumatic brain injury. So the relationship between Parkinson's disease and dementia. So dementia, usually you see an effect on the thinking, the memory, the judgment, their attention. People with Parkinson's disease, it's gonna appear very similar after they experience changes with their motor symptoms. Then you end up seeing some more of the cognitive decline as the disease progresses. So 50 to 80% of people with Parkinson's may end up developing dementia. Symptoms of Parkinson's dementia: slowed thinking, poor concentration, memory problems, difficulty with planning or problem solving, changes with mood, and late-stage visual hallucinations. You'll see also the Lewy bodies and the brain changes can be very similar in appearance with those two. Parkinson's disease dementia is linked to abnormal protein clumps called Lewy bodies, which is also, like I mentioned, found in Lewy body dementia. Those proteins disrupt the areas of the brain where they accumulate, and they involve movement and cognition. So treatment considerations, of course, balance motor and cognitive symptoms. So you've got to address the motor and the physical needs, but also the cognitive needs of both diseases. Some medications can worsen confusions or hallucinations, so that's one thing to be aware of and look for. You want to have routine cognitive screening just to track that progress and try to prevent further decline. And non-drug approaches would include having structured routines, keeping cognitively young, your word search puzzles and Sudoku and playing cards with your friends, all the fun things that I'll do when I retire. And medications like rivastigmine can be helpful. So here's dementia medications. I'm not going to speak too much on this, but I did notice a little trend here. And I do have a patient right now. Her doctor is decreasing her rivastigmine because she is having symptoms of diarrhea, 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 diarrhea. So it's not uncommon to see some changes to your gut function with some of the medications. There are some side effects there with that. Dizziness is another common one. So these bottom three are all referring to some issues with dizziness. So that's something, if you already are having issues with low blood pressure or orthostatic hypotension, or issues with coordination and balance because of Parkinson's disease, that is something to watch for. Many medications have a side effect of dizziness. It doesn't mean you have it, but enough people have it that it's listed. These are some additional medications that are given for dementia and arthritis. So these are the most common types of arthritis, but wait until you hear how many different types of arthritis there are. I learned a lot making this presentation. So osteoarthritis, we've all heard of this one. Fibromyalgia, we know of that one. It's a very terrible thing to have to go through. Gout, you didn't think that gout was part of that, right? But gout is actually a type of arthritis. Rheumatoid arthritis, which we know is autoimmune, and lupus, which is also autoimmune. So here's a little comparison of the two types of arthritis that we're going to mention today. So rheumatoid arthritis, the differences between osteoarthritis here are that osteoarthritis is usually or can be just one-sided, where rheumatoid arthritis, you're going to see the joints are affected pretty symmetrically. But it doesn't mean that it's not osteoarthritis if you have it in both knees or something. You're both going to see pain and stiffness and inflammation, but the morning stiffness with osteoarthritis doesn't last quite as long in the morning when you wake up. Here, it's a degenerative disease where you have a loss of cartilage, and cartilage it doesn't have a blood supply really in the sense that it cannot regenerate itself the way that so many other parts of our body can. And with this, it's actually inflammation in the joint membranes here. Then one of them is autoimmune, where the other one is degenerative. So early signs of osteoarthritis, probably not new information, but it is a degenerative, meaning a breakdown of the joints. Anything ending in itis is inflammation. More than 100 types of arthritis and related conditions. There are more than 100. Isn't that wild? My goodness. I don't want to know what all the other ones are. These ones are hard enough to deal with. It is most common among women, probably because we spend 15 years of our lives carrying around our children, right, on our hips and stuff. Can cause permanent joint damage. And who knew arthritis can also affect your organs, your eyes, your skin. So here's some common symptoms that we shouldn't ignore. Bone spurs, extremely painful. Clicking or cracking sounds, I already have those. Reduced flexibility, getting hard to move around and bend over. One thing I really like to encourage my patients to do is functional fitness. We go to the gym and we think that's the only place that we can get exercise and work out, right? And we might go a couple times a week, but think about all of the hobbies and activities that we can do that are active. Here's an example, gardening, okay? You're bending over, you're kneeling down, you're squatting, you're pulling weeds, it's definitely active. It's not, a marathon, but it's getting those muscles working, it's getting you moving, keeping you flexible. Osteoarthritis, like I said, it's a breakdown of the joint cartilage and the underlying bone. The cartilage wears away, the bone rubs, and I don't have to tell you how painful that is. It just sounds terrible. Age, genetics, obesity, joint injuries, and repetitive stress on the joints are common risk factors. So traditional medicine focuses on managing the symptoms, pain management, joint replacement surgeries, and those can be extremely effective. Functional medicine takes a holistic approach, aiming to alleviate symptoms, slow the symptoms down, and if possible, reverse the progression of the disease. So causes, like we said, cartilage is avascular, so it doesn't have blood vessels, so it can't regenerate. And I won't read you all of the details. This is very, what's the word for the jargon of medical things that people don't understand, because I don't. Mechanical stress and systemic inflammation end up causing the degradation of the chondrocytes, which is the cartilage, and that leads to progression of osteoarthritis. Here are some common drugs that are used to treat osteoarthritis. We all know Tylenol, acetaminophen, topical pain relievers, NSAIDs, non-steroidal. So they're not a steroid, but they're anti-inflammatory drugs. There's plenty of those, ibuprofen, Aleve, Advil, Motrin are some of the common brands there, but there's also Celebrex and meloxicam. It's endless. Corticosteroids, hyaluronic acid, and narcotic pain relievers. So NSAIDs and other anti-inflammatory drugs turn off the body's immune system. So your body has pain to tell you that there's a problem, right? If we did not experience pain, we wouldn't know that there was a nail stuck in the bottom of our foot. If we didn't experience pain, we wouldn't know that we've got a fungal infection in our mouth, right? So our body it's a protective mechanism. It's a compensation to say, hey, there's pain here, pay attention to me. Don't ignore this, and don't try to mute it with medications unless you know that there isn't another thing that you can do about it, right? You want to remove the nail that's stuck in the bottom of your foot before you just start taking Tylenol, right? So again, they aren't bad things, but what else can we do to help our bodies? So we don't necessarily always want to mute our body's response. Sometimes it's our body's way of asking for help. So very common treatments, at-home treatments, professional support, things like acupuncture, kinesiotaping has been very helpful when I have had joint injuries, sports-related. Kinesiotape, I think it's worth its weight in maybe not gold, but something like a little bit more affordable than gold. Physical and occupational therapy, which I hear you guys offer here, that's wonderful. Pharmacological approaches there. And surgery, joint replacements are sometimes necessary. This, again, adds to some of the other ideas for non-pharmacological therapies to treat osteoarthritis. Supplementation, there are supplements that can be helpful to slow and improve symptoms, and anything that you can do to improve cell function and immune system function. So the body, we're made up of cells, okay? And a cell needs, every single part of the cell has to work and function for the cell to survive. If one thing within the body's cell, one cell, isn't working properly, the cell will die, right? So if we can address things even on a small level, on a cellular level, to give the cells what they need, then we can solve some of the bigger problems. The immune system manages inflammation and anti-inflammation. And inflammation, acute inflammation, is not a bad thing. If you sprain your ankle, or if you get a large scrape or tear on your leg, your body's it's gonna bleed and it's gonna draw and swell, right? And we tend to say, oh, put an ice pack on it. We gotta get the swelling down. But that's your body's response. Your body is swelling to bring all of the nutrients and the clotting factors and the protein that it needs to start the healing process. So inflammation is not a bad thing. It's a normal, natural response. When inflammation becomes a problem is when it's chronic, when there is a problem and the inflammation isn't going away. That's when we've got a problem. So the immune system wants to do its job and clean up the bad guys, fix the problem, promote healing, bring what's needed to the area that's causing us pain. But the problem of autoimmunity and metabolic syndrome isn't that there's inflammation, it's that there's something confusing the body to start attacking itself, which causes chronic inflammation. Parkinson's disease and arthritis. We'll touch on these on the next slide. So osteoarthritis and Parkinson's, we know Parkinson's causes rigidity, slowness, tremors, reduced coordination. It increases your risk of falling. Osteoarthritis, many similar things, still the stiffness, the joint pain, reduced range of motion, especially in your joints, your knees, your hips, your hands. And together, having both of those diagnoses, it's going to increase difficulty with walking, sitting to standing, dressing, reduce physical activity, and increase your risk for falls. So there's a lot of overlapping symptoms, and what's important is that doctors do a thorough check to make sure that we're addressing the symptoms from the right disease, because how you might treat stiffness in Parkinson's is going to be different than how you treat stiffness from osteoarthritis, right? Impact on rehabilitation. If you have an osteoarthritis injury and you have Parkinson's disease, again, how you do therapy and what the goals may be are going to be different. We need to address both diagnoses a little bit differently. And pain and joint deformities can prevent patients from participating fully in the routines that they should be doing for exercise for Parkinson's disease. So it's definitely a hardship if you have arthritic pain that is preventing you from doing the exercises for Parkinson's that you know are beneficial. A few other things, medication interactions. There can be side effects, so that's something just to be aware of with the pain medications, more likely GI bleeding and some cognitive effects of some of those stronger drugs for pain management. There's mental health considerations, because when you have chronic pain and impaired mobility, you may have an increased likelihood for depression, anxiety, and isolation because you feel like I can't get out and do the things that I want to do, and that's very limiting. Clinical insights here would be treating both conditions together, and that requires a team approach, making sure that you have the right people, the right doctors and professionals to address all of the things in all of the ways that you know, so that you can increase your mobility, independence, and your quality of life. And lastly, how am I doing on time? Pretty good. Okay. Hyperlipidemia, sorry, if I'm talking too fast, just wave at me and I will slow my talking down. And if there are slides that you would like to see, I can go back at the end, so you can either take a picture or I can send the presentation to Sally and she can share it with anyone who wants it. Hyperlipidemia and hypercholesterolemia. So optimal ranges, we like to say under 200, right? I will mention this number has gone down several times over the years. It used to be 400 was optimal, under 400, then it was under 300, now we're at 2, which means a lot more people have problems and need medication. So I'm not sure what that might mean. LDL, we call that the bad cholesterol. That's low density lipoproteins. It's not bad, it's there for a reason, but too much of it is going to be a problem. And what we need to also be looking at is not all LDL is bad. It's the ones that are fluffy and big and like clouds. We like those ones, but the ones that have they're smaller and they're irregular and they have deformities, those are the ones that are the bad ones that we want to minimize. HDL, we call that the good cholesterol. That's high density lipoproteins. And that number we want higher versus lower. So a lot of times I see patients, their numbers for HDL are like 30 or 40. We would really like them to be much higher, like 60 or 80. Triglycerides, lower is best, right? 50 to 100, and then the total ratio. So what even is cholesterol? Does anybody here believe that cholesterol is a terrible thing and we should avoid it at all costs? You guys are such good students. Yes, cholesterol is a wonderful thing. Cholesterol is not what causes cardiovascular disease. Actually, I learned that in pregnancy, your cholesterol doubles and triples because your baby needs healthy cholesterol fats in order to develop properly. So I went to my doctor and she took my cholesterol levels at one point when I was pregnant, and she's like, you need to make all these changes. You need to change your diet. You need to start doing this. I was like 5 or 6 months pregnant, and I said, it's good that my cholesterol is high. I'm pregnant. You know I'm pregnant. It was a normal, healthy thing that my body was doing to support my baby. So cholesterol, it's an essential substance. It helps with numerous functions in the body. It circulates in the blood, and it is found in every single cell. It helps with several functions: building new tissue, repairing damage to existing tissue, produces steroid hormones, including estrogen, that happens in the liver. It helps create bile, and it aids in the production of vitamin D. So if your cholesterol is low, you're going to have trouble synthesizing vitamin D from the sun. So this was interesting. The World Health Organization looked at a wide range of populations and their cholesterol and heart disease rates because they wanted to find a correlation that heart disease is correlated to high cholesterol. And guess what? They found the opposite. So they looked at the Aboriginals in Australia. They had the lowest cholesterol levels, but the highest rates of heart disease. Then they looked at France, and the people in France had 15 times higher than those in the UK. And the Swiss had some of the highest cholesterol levels, but a third the rate of heart disease that the UK had. So this is mind-blowing. And here's why. They did a nutrient study, this is now 7 years old, that revealed that heart disease has more to do with saturated fatty acids and trans fat. So these are the bad guys that we want to try to avoid, not dietary cholesterol. So because foods commonly both have cholesterol and trans fats, right, we were pointing the finger at the wrong one, okay? So eggs are not the enemy. Eggs are so good. I mean, too much of anything could probably be a problem, right? But cholesterol is good. Our body needs it. Our liver needs it. So low-fat, low-cholesterol diet has been found to increase triglycerides, decrease the HDL, which is the one that we want to be higher, and increases the small, dense, low-density lipoproteins, and increases inflammation, okay? So, wow. Hydrogenated and partially hydrogenated oils, trans fats, and polyunsaturated industrial seed oils. Those are the main culprits here. So corn oil, vegetable oil, soy oil, canola oil. And if you read the ingredients on like anything you buy in a package at the grocery store, it's got genetically modified corn and soybean and safflower, sunflower, all of these oils that are derived in this process that we're getting these hydrogenated oils, and that is what is causing such an increase in the metabolic disease in America. So something, I'll actually get to it, I'm getting ahead of myself. So they found refined carbohydrates, so processed carbohydrates, all of the breads and the pastas and the cereals that we eat for breakfast every day and for dinner every night, the vegetable oils and corn syrup. Corn syrup is in everything. They'd hide the word corn. It's amazing how many things actually contain corn. I'm pretty sure that's the worst allergy to have, because an allergy to corn means an allergy to almost everything, because it's in everything. They just find new ways to use the corn and process it. It's wild. And our ancestors have never even heard of these three things. So the top 3 sources of calories for Americans today: the carbs, the vegetable oils, which is the polyunsaturated fatty acids, and the corn syrup. Though that is where we get our calories. And our ancestors don't even know what those things are. So here's some lifestyle changes, some recommendations for lowering cholesterol: eating a well-balanced diet rich in fiber. Fiber is good. Lower saturated fat and trans fat consumption. We have some pictures of some of our favorite foods there, right? Incorporating healthy fats into our diet, so knowing what foods have healthy fats. I feel like they should have put an avocado there, because those are really great. Exercising regularly, avoiding fried foods, and if you are going to fry your foods, consider what oil it's fried in. So you've heard of McDonald's and some of these restaurants. Actually, I don't know if McDonald's is one of them. They're switching back to beef tallow. That is what everything used to be fried in, was beef fat from a cow, was the cow fat. And some restaurants, I think Five Guys is one of them, they're switching back. So instead of these processed, peanut oils and vegetable oils that they, fry all of our food in at all of the fast food restaurants that we love, that's a huge source of where we're getting these unhealthy fats that are causing the problems. And stop smoking. Don't smoke. So here is some of the things that we want to use instead. I make homemade donuts fried in coconut oil, and they are amazing. Coconut oil is a great one. Tallow, lard, ghee, clarified butter, if you haven't heard of that one. So some of those healthier fats, and then most commonly, extra virgin olive oil, butter, avocado oil. These are all better choices than like a canola oil or a corn oil or soy or sunflower. So here's some causes of high cholesterol. Metabolic dysfunction, so that keeps coming up, where our body is just not going through the processes of digestion and how to use and store energy that we eat properly. Insulin resistance, poor gut or liver function, Then chronic infections, H. pylori, that's already come up before. Latent viral infections, so something like Lyme disease or CMV. Gut dysbiosis, where your microbiome, the healthy bacteria in your gut, are the levels are not right. So if you have too much of one bacteria in your gut and not enough of another, then you're going to have issues even with immunity. One thing worth mentioning is overprescribing antibiotics is hurting our gut and our immune system, which can in turn cause things like allergies and all, because our immune system is then overreacting to things. So with antibiotics, you have to keep in mind that you're not only killing the bad bacteria that we need to get rid of, but we're also killing some of the good bacteria. So it can take up to 2 years to replace that good bacteria after taking an antibiotic. So whatever we can do to help support our gut health and the right microbes in our gut is important. Having suboptimal thyroid function can cause high cholesterol. You wouldn't think that's connected. You think that I think of the thyroid as kind of totally separate from cholesterol. But in looking at trends of labs, you tend to see that your thyroid function is maybe slightly off when your cholesterol is also slightly off. So there is a correlation there. Environmental toxins, especially heavy metals, that's a big one. Heavy metals, we're exposed to it in all kinds of ways that you just wouldn't even imagine. And genetics is a factor. I think my family has a lot of heart disease, my aunts and uncles, my parents, cholesterol issues, blood pressure issues, diabetes, and I'm bothered to accept that I'm going to have those problems too. So I'm trying to educate myself on how I can make sure that my predisposition of having those diseases is it's not that I'm going to have those diseases, but what can I do so that my body is strong enough to fight those things and prevent them? So the predisposition does not equal the disease. I believe that we are able to prepare our bodies to be healthy enough to get over an illness quicker. That's why when some people, two people have the same flu or the same cold, their symptoms are going to be very different. It's how your immune system is able to manage. So you could come in contact with a virus, your friend gets sick and you don't get it at all. And it's not necessarily because you've had it before, but it could be because you were getting enough sleep and you were eating, the right foods and doing all of the right things to support your body. You had the nutrients, you were taking your zinc and your vitamin C and your vitamin D and all the things to support your body's immune system so that when it came in contact with that virus, it was just shut down. Medications for high cholesterol. So the biggest one here is the statins. Those are the most commonly prescribed, and they're the most effective in lowering LDL, the bad cholesterol, we say. Niacin, that one you don't really see so much, but the fibrates, that's another one that's common. Then Zetia, you see sometimes. I don't see too much of the combined medications, but in special cases. So we know that statins lower the LDL, but statins can also introduce additional concerns: muscle damage, body aches and pains, inability or an altered ability to build muscle, sometimes can affect your memory and cognition, and cause Parkinson's-like symptoms. So we know this is proven that statins can increase the risk of diabetes. For every 50 people taking a statin, it does prevent one heart attack. For every 890 people, a death is prevented. But what does that mean for everybody else? Is that, you have to weigh the benefits and the risks of these kinds of things. So this was a quote from the Johns Hopkins website that I found. Statins, the benefits of statins outpace the risks. And they did a 20-year review going back and looking at 150,000 individuals. And they believed that the benefits outweighed the risks, but it did mention the risks of memory problems and of diabetes. So again, it's important to know, because sometimes doctors don't know these things. I don't think that doctors are evil. I don't think that they're trying to hide this information, but they may not have learned that information. We teach in universities, we teach the medications as the treatment. And there's not a lot of treatment or there's not a lot of education on even diet and nutrition. Doctors are not required to take nutrition courses, and at best, they may be required to take 1 or 2 nutrition courses. But food is medicine, so there's so much more for us to have to learn on our own if our doctors are not already aware of that, to share with us. So some treatment options here. We love to hear it. Lifestyle changes, yay, exercise, healthy dietary fats and fiber, sleep, getting the right blood tests, right? So there are very specific tests for cholesterol that give you a better idea, because maybe your LDL cholesterol is high, but if it's the good fluffy ones that we like, then it's okay that your LDL cholesterol is higher than what the standard says. So it's knowing what to look for, eating the right meats, and then looking for alternative causes. So I'm getting to the end of it. Hundreds of studies link commercial meats, so industrial farm lot meat. That's like when you have like tons and tons of pigs all squished together in a pasture, or a whole lot of cows, right? They link this to heart disease because those animals are not being fed the food that they were intended to eat. Okay, the cows they're not intended to eat genetically modified corn and soybean, which is what most U.S. farms produce. They produce the corn and the soybean not for us to eat. They produce it to turn into grain to feed to the cows and the pigs because it's very, very affordable. But that's not what cows were intended to eat. Cows were intended to eat grass and hay, right? And when the cows are eating the corn and the soybean, it's hard for them to digest it because that's not what their bodies were made to eat. So then the cows are given things like omeprazole, believe it or not, Prilosec over the counter, and the cows are given these drugs to help them digest the foods. And then they get the farts, and people think that, the world is going to collapse because the cows are farting, right? It's crazy. So the genetically modified grain that's fed to the animals, along with, because then their gut is a little bit wonky because they're not eating the food that is helping them to be healthy and strong, then they end up with modified body pH. They end up with an increased likelihood of infections. So a lot of them are having to go on antibiotics, right? And then we try to buy the meat that's antibiotic-free cows, right? Where it's just crazy to think about, right? We buy the dairy that has to be pasteurized but pasteurization actually, that kills off the nutrients, the enzymes, and that's why, because it kills off the lactase enzyme in the milk that's naturally occurring in raw milk. That's a whole other thing. I'm getting on a tangent. But all that to say that it changes the fatty acid ratios in the meat, so there's less of the good fats, and that makes the meats a little bit more inflammatory, okay? Because you are what you eat, and the cow is what the cow eats. And we eat the cow, and this could be causing chronic inflammation. So a lot of times doctors will say, you eat too much red meat, don't eat the red meat, right? Well, I would ask your doctor, what if I eat 100% grass-fed, grass-finished meat? Maybe it would make a difference. I don't know. So here's some supplements for high cholesterol. The healthy oils, the healthy fats, right? Fish oil, EPA, DHA, vitamin D3, niacin, that's a B vitamin, resveratrol, sesame, garlic, soy. Some of these are things that you can just easily incorporate, in your Italian pasta. Just add some extra garlic tonight. Green tea. We're almost at the end. So surprising research suggests that higher cholesterol levels may be associated with a lower risk of developing Parkinson's, especially because of that, with that bad cholesterol. It's counterintuitive because we think high cholesterol is what's a risk factor in so many other diseases, right? But the explanation is that it may support healthy brain function, right? It's cholesterol, like we said, is like a healthy fat, so it protects the neurons, it supports dopamine production, and it regulates the synaptic activity. It's the activity between the neurons. So it's possible that low cholesterol levels might reflect poor neural health or decreased neuroproduction. So it's funny because some studies, right, link statin use to reduced risk of Parkinson's disease, and then others say the opposite. So definitely more research needs to be done there in whether or not high or low cholesterol. So the best we can do is make good dietary choices. Shared risk factors there, already spoken. Cardiovascular health matters. So a healthy heart means better brain perfusion and better support for brain cells that are affected by Parkinson's disease. So it's not a black and white, cholesterol is good or cholesterol is bad in that sense. It's that doctors need to balance the cardiovascular risks with the neurological health in people with Parkinson's. And that is all that I have to say in just under an hour. So I'm not in a rush to leave. If you guys have any questions for me.
Vascular issues with brain, the oxygen going to the brain and causing dementia.
Mm-hmm.
I recently took Mike to Sarasota Hospital because I knew from a VA test he had clotted arteries in his neck.
Mm-hmm.
And they refused to accept the idea. They told me it didn't affect oxygen because he was beginning to show signs of dementia, and he's still in that cloud. And I'm still trying to get to the bottom of it. I ordered a swab test where they swab your genetics against all the medications that Mike takes.
Oh, cool.
And
where are you doing that through?
the company's in Pennsylvania.
Okay.
And somebody in Sarasota called me to say that they got our application, they're waiting for Medicaid.
Okay.
It's been at least 5 weeks. I called them last Thursday, and I still haven't heard back, so I'm gonna call Pennsylvania again
Yeah.
and see what's happening with that test.
Have you guys heard of Gray Matters? Have they ever been here to speak? Gray Matters. So they're a local business, and they do a lot of that. They look into brain health. They rule out all other factors. So they do the extensive blood work to say, okay, it's not because of heavy metals. It's not because of, pesticides and herbicides that have accumulated in your body. So I would definitely follow up with that. I think that second opinions can always be helpful. I think seeing doctors that specialize in different areas, so seeing, an allopathic doctor, but also maybe seeing a functional medicine doctor might be beneficial because, again, they're wanting to look at root causes. I think that you're onto something there, depending on how much stenosis he has in his arteries there.
They said it was there, but it didn't need treatment right away.
Okay.
But then at the same time, then we got in to see a cardiologist, and they did a stress test, and Mike does have more clotting around his heart. He was supposed to have surgery next week. I ended up canceling it because I'm trying to get him into the Mayo Clinic, because I will not bring him back to Sarasota
Okay.
Hospital again. I will avoid that hospital.
Mm.
Just because their attitude, they told me that he has Parkinson's, Lewy bodies, and dementia. And he just finished a 3-year study for Alzheimer's.
Wow.
They only found a little bit of decline in February 22nd of this year. And when I explained to them what Mike's going through, they said it would never rapidly get to the position where Mike is now.
Okay.
They saw in February.
Hmm.
And that's what I'm just,
I would look into Gray Matters. They're local here.
they are local.
Yeah, they're local.
So just look
I will
up
give them a
Gray
call.
Matters.
I can give you the number after.
Oh, okay, thank you.
Yeah. Anybody else? Any other questions, comments? You're very welcome. Thank you. I actually was hoping to have 5 points, but at how long this became, I did not talk about diabetes because that would be probably a whole nother hour. So I cut it to 4. Yes.
Very good.
Yeah.
People who have multiple system
Okay.
have a Parkinson's component, but I have to take blood pressure medicine
To get your blood pressure up.
to raise
Yeah.
myself, even if I'm at 120 or 130.
Mm.
They want me jacked up over 160.
Wow.
I drop fast I won't drop to the 80.
Yeah, so there's a couple of reasons why doctors often want your blood pressure elevated is because sometimes if you have issues that cause the blood pressure or the vasoconstriction or narrow pathways, you need a higher pressure in order to perfuse your brain, to perfuse your organs. But it sounds like with you, the reason why they want your blood pressure to be elevated is because when it does drop 30, 40, 50 points, it's fast. And if you're 120 and it drops, that's a problem. But if you're 160 and it drops, it's not as big of a problem. Yeah, that's tricky. That's a really hard balance because we don't want your blood pressure necessarily up at 160, but the risk of falling, fainting, the dizziness, that can be very limiting. Thank you guys very much.